welcome. Today we're diving into a topic that is absolutely essential for anyone expecting a baby: medication. Because let's be honest, the moment you get that positive test, it feels like the rule book for every single pill, from your prescriptions to a simple Tylenol, gets tossed out the window. So the big question is, why? How can a state like pregnancy completely change the game for every supplement, every remedy, every pill you might take? Well, that is exactly what we are going to unpack today. I want you to think about it like this. Your body is suddenly running a brand new, very complex operating system. All the old settings, the old defaults, they just don't apply anymore. This upgrade means your body handles everything differently, especially medications. What was totally harmless before now needs a really careful second look. And these changes, they are happening everywhere. For example, your total blood volume skyrockets, which can actually dilute a medication, maybe making a normal dose less effective. Meanwhile, your kidneys are working overtime, flushing things out way faster. And your GI system and liver, they're on a whole new schedule for absorbing and breaking down drugs. There's a fancy term for all this: pharmacokinetics. But what it really means is that your body is a whole new environment, and that's why a doctor's guidance is absolutely non-negotiable. You know, there's this common myth that the placenta is this perfect, impenetrable shield that protects the baby from everything. But that's just not how it works. It's much more like a gateway or a very busy border crossing. Lots of drugs, particularly smaller molecules, can pass right on through to the fetus. And here's the kicker. Because the baby's liver is still developing, it can't process these drugs. So they just hang around, longer and stronger. This brings us to a really critical point. When it comes to risk, timing is everything. Those first 2 weeks after conception are what's called an all-or-nothing period. But the most vulnerable window, the one we worry about the most, is from week 2 to week 12. This is when all the major organs are being built. It's called organogenesis, and it's the highest risk time for major birth defects. And even later in pregnancy, drugs can still affect the baby's growth and how their organs function. Okay, so that covers the why. Now let's get practical. How do you actually deal with all those fun, everyday discomforts of pregnancy, but safely? You're going to hear me say this a lot, but the golden rule is always, always start with non-drug fixes first. First up, the all-time classic, morning sickness. And let's be real, whoever named it morning sickness was playing a cruel joke. It can be an all-day affair, and it affects up to 88% of pregnant women, so if you're going through it, trust me, you are in very good company. So before you even think about medicine, there are some simple things that can make a huge difference. You know, keeping crackers by the bed and nibbling on them before you stand up, eating small meals all day, steering clear of spicy or greasy foods. But if that's not cutting it, there's an FDA-approved combo medication. It's just vitamin B6 and an antihistamine called doxylamine that's been proven to be both safe and really effective. All right, next on the list, heartburn. That lovely burning sensation. You can thank the hormone progesterone for that one. It does a great job relaxing your uterine muscles, which is good, but it also relaxes the little valve that keeps stomach acid where it belongs, leading to reflux. And again, let's start with lifestyle fixes. Smaller meals and not lying down right after you eat can be game changers. If you do need an antacid, some are okay, but, and this is a big one, you have to avoid any that contains sodium bicarbonate. You know, baking soda. It can actually be harmful, so you've got to read the labels and, of course, talk to your doctor. Headaches, backaches, just feeling kind of sore all over. Yeah, that's pretty much part of the pregnancy package, isn't it? Your body is doing incredible work, carrying extra weight, your posture's all different, so it's no wonder things start to ache. You know the drill by now. Try the simple stuff first. Rest, a warm bath, maybe an ice pack. If you need medication, acetaminophen is generally considered the safest bet throughout the entire pregnancy, as long as you use the right dose. But what you absolutely must avoid, especially in that third trimester, are drugs like ibuprofen and aspirin. They can cause really serious problems for the baby's heart. It's a huge deal, so stay away from those. Okay, let's shift gears now. We've been talking about managing discomfort, but some of the medications used in pregnancy aren't for comfort at all. They are for high-stakes, absolutely critical situations where they can literally be life-saving for the baby. And we're starting with preterm labor. This is when the body decides it's go time way too early, before 37 weeks. When that happens, the goal of the medical team isn't always to stop labor for good. Instead, it's all about one thing: delaying the birth just long enough to give that baby a much better chance. To do this, doctors use a class of drugs called tocolytics, which basically tell the uterus to pause the contractions. And the magic number they're aiming for is a delay of at least 48 hours. So why 48 hours? What's so special about 2 days? Well, it's because that's the precise window of time another incredible medication needs to work its magic. And that medication is a corticosteroid. It's given to the mom as a shot, but its real job is inside the fetus. Over those 48 hours that we just bought, this steroid goes to work supercharging the development of the baby's lungs. It is an amazing, time-sensitive intervention that can dramatically lower the risk of a preemie having serious breathing problems after birth. Now let's talk about another serious condition that needs really careful medical management: high blood pressure in pregnancy. This can sometimes escalate into a much more dangerous condition called preeclampsia. Preeclampsia isn't just about a high number on the blood pressure cuff. It's a complex disorder that can affect the mother's entire body, causing damage to organs like the kidneys and liver. And really, the only true cure for it is to deliver the baby and the placenta. But here's a surprising fact. When preeclampsia gets severe, the number one most important drug that doctors use isn't even to lower blood pressure. Nope, it has a different and even more critical job to do. And that drug is magnesium sulfate. Its whole purpose is to prevent preeclampsia from turning into eclampsia. And eclampsia means seizures, which are incredibly dangerous for both mom and baby. Magnesium works by basically calming down the central nervous system to prevent those seizures from ever starting. Now, because this stuff is so powerful, patients are watched like a hawk for any sign that the dose is too high. And you know what the very first warning sign is? It's not a beep from a machine. It's the loss of reflexes. A nurse will literally come in and tap your knee with a hammer over and over. If that reflex starts to get sluggish or disappear, that's the signal to the team that the dose is too high and they need to back off immediately. And here is the crucial safety net. There is a direct, fast-acting antidote for too much magnesium. It's called calcium gluconate, and it is always kept right there at the bedside, ready to go at a moment's notice to reverse the effects if they need to. So, after all that, what should you take away from this? Let's boil it down to 4 golden rules. 1. Always try the non-drug stuff first for minor things. 2. Never ever take an over-the-counter medicine without running it by your provider. 3. Don't self-medicate. What worked for your friend or even for you in a past pregnancy might not be safe this time. And 4, your doctor or midwife is your co-pilot. You're flying this plane together. Which leaves us with one last thing to think about. Instead of waiting until you have a headache or heartburn, what's the one conversation you can have with your doctor now about a medication plan so you're ready long before you ever need it? Thank you so much for joining us.